Hi, Dr. Cleveland, and hello to my fellow classmates. I'm happy to be joining again for my last semester of this directed readings to finish out my thesis. My name is Ebun-Popoola. I'm a senior honors human performance major, biology and chemistry double minor from Southern Maryland by way of Nigeria. And my research topic is about pediatric concussions. So, the study I'm looking at is called the Recover Study. It's from an internship I did after my sophomore year, the summer after my sophomore year, and that's kind of the study we were looking at. It's clinical research, and so it's looking at progressive preventative measures or treatments for mild traumatic brain injuries or concussions in a pediatric setting. This is really important because concussions are a prevalent problem. I'm sure somebody you know has had a concussion. We've all heard about them, and we don't realize, but concussions can have long-term effects if not treated quickly enough. Or so this treatment is looking at, faster measures for the healing of the concussions. That way, these long-term effects have a less likelihood of playing out, and children can return back to normal faster because, of course, as they're still developing, these can also be more severe with long-term effects that can carry into adulthood and other things like that. um, and so the problem of the research is right now is that concussions are a prevalent problem. So we're trying to see if, so usually when people have concussions, many times in the past, doctors have said, okay, sit in the dark, don't really do anything, just kind of let rest and lay. The problem, or I guess more solution that we're trying to address, is seeing if these methods of just sitting and really doing nothing is less effective than aerobic exercise, limited screen time, light activity to go along with that, sitting kind of in the dark, but also adding some moderate activity in there to see if that progresses the brain better. And this is interesting to me because I feel like it's really applied my major firsthand. Looking at human performance, it deals with athletes because a lot of times these concussions are because of sports injuries. And in this study specifically, we're looking at kids from sports related injuries. So it's like taking the things we've learned in athletic training, first aid and CPR, but applying it to a clinical research setting, which is useful for me as I'm journeying on and want to go to medical school. And then it's just important because children's brain developing, it's so vital that they're protected and that when anything happens, treatment is as effective and quick as possible. So by doing this and trying to find a more effective and quick treatment, we can possibly be helping the next set of kids who are going through this. So yeah, very excited to be finishing this out, looking at data collection and analyzing that. And yeah, thank you.